As far as PCOS goes, I think one of the most common misconceptions is you have to be obese, you have to have this excessive hair, you have to be balding and, no periods. But there's variants of PCOS, and PCOS is you rule out everything else and then you rule in PCOS. There's not one blood test that looks for PCOS. There's not one ultrasound that says, oh, you have PCOS. It's a conglomerate of various symptoms that fail to meet other common diagnoses that mimic it.
This month, PCOS advice is everywhere. So to round out our month of information on PCOS, I'm going to introduce you to a doctor who's also been a PCOS patient. She's had a really hard time dealing with symptoms, dealing with infertility, and dealing with so many difficulties. And I think you'll find it fascinating to hear how she's managed to both help herself and her patients. So dive in. You're going to find this episode really helpful. From our Building Your Family community, this is the Building Your Family podcast. I'm your host, Lisa Schuman, author, researcher, and reproductive medicine therapist. As the leading destination for support and education for people using reproductive medicine to grow their families, we cut through the noise to provide you with research-based information, effective and actionable strategies, and the support that you need to feel better, so you can get into the driver's seat of your life and build the family of your dreams. We look forward to seeing you inside. Welcome to the Building Your Family podcast. We are now in PCOS Awareness Month, as many of you know, and because we feel so strongly about you getting the right kind of information to treat whatever is going to block your way to build the family of your dreams, you need to have this information. So to that end, you've probably already seen we had a reproductive endocrinologist and a patient advocate, and today we're going to introduce you to somebody very special who's had both experiences. She can give you the perspective of both the physician and also the patient. She's very popular on social media and has done so many things to help so many people with mom guilt and hydrocele pinks and every other issue you can possibly imagine. We're very grateful to her for factual information, which we really need. And today she's going to talk about PCOS because that's very close to her heart. So welcome. So nice to see you, Dr. Jelani.
So nice to see you, and so grateful and honored to be on here. Thank you for having me.
It's really my pleasure, and I love watching you on social media, and I'm so grateful that you spread helpful information to everyone. And I'm also grateful that you're willing to tell your story to the public, because I think it's so nice for people to hear that you've actually struggled with this very difficult problem.
Thank you. Well, I was diagnosed with PCOS when I was really young, and I couldn't comprehend what it actually meant, because all I took away from that conversation, and I'll tell you a little bit about it, is that there's a type of doctor that helps build families, which goes with the title of your show, Building Families. And I was so fascinated with that concept, and the ability to do so, that I put my diagnosis aside, and I was so enamored of how can it be this?
Wow, that's amazing. So that's what caused you to be a reproductive endocrinologist?
Yeah, it actually did. My parents, when I was younger, got divorced very early, right around when I was a teenager, around 12, 13. And it was a very traumatic relationship, a very traumatic divorce. And we moved back to Chicago, and my mom was a housewife, and she learned how to not be a housewife, to learn how to work 2 jobs. And she had no skill set, no trade. So she was very stressed. As you can imagine, a single mom raising 3 very young kids. And I was the oldest of the 3. We were bouncing around from family members' houses while we kind of built our life. And in the middle of all this, she realized that I hadn't hit puberty and all of her nieces had. And she remembered that she had by the time she was 12. So she was really worried about me. So she started taking me to my pediatrician, then to my primary care, then to multiple doctors to figure out what's going on. And everyone would say, either she's fine. I remember my pediatrician saying, this is when eating disorders happen, that I have an eating disorder. So increase my caloric intake and come back in a year. So every day we would literally go to Burger King. I would get a croissant sandwich if you
Oh my
are
goodness.
young enough or old enough to know what that is. I'd get a croissant
Mhm.
sandwich, a Dr. Pepper, and a Snickers bar. That would be my breakfast. And we did that
Wow.
for a whole year straight. Clearly, it was definitely making my PCOS worse.
Yes.
But we went back a year later and she was like, I tried this doesn't work. And now I'm 14. So now my uncle, who's a primary care doctor, said, I really think you need to see an reproductive endocrinologist, and maybe
Wow.
it's a genetic abnormality, or maybe we're missing something. So you need to see a fertility doctor, essentially. So before, and I think it's starting to come back now, fertility reproductive endocrinologists did end-to-end care. So we did puberty, we did perimenopause, postmenopause, not just fertility. So we did truly endocrinology and infertility. So she saw me, and I remember sitting in her waiting room at this hospital and being so nervous and really scared, right? You're this young girl, you're in this office, and everyone's much older around you, and you could feel the tension almost in that waiting room. There was like a lot of mixed emotions. There was crying, there was weeping, there was anxiety, and I honestly didn't know what I was doing there. So we walked, they called my name. I remember walking back and sitting on that table, and she asked my mom to step out as soon as she walked in. And literally, as I was looking around the room, all I could see was, I don't know if you remember when the doctor's offices used to have posters up on the walls.
Mhm, mhm.
So I remember seeing like a baby coming out of the birth canal, and I remember seeing a vagina and a penis, and I was like, oh
Wow.
my God, like, where am I? What am I going to, what's going to happen here? um, so finally, I looked around the room and I said, what do you like? What kind of doctor are you? What do you do? Because I wanted to know what was going to happen to me and why I was there. And I remember very simply, all truly, like in 3 words, she said, I help make babies. And that was it. That was like life changing for me.
Wow.
Yeah. So I told her, I remember being like, oh my God, I thought God made babies. I, I didn't know you make babies, and how do I be you? And then, of course, she diagnosed me with PCOS. She told me I'm going to need her help. But every year I didn't care. I was like, tell me how I be you. Like, how do I follow your path? How do I come work with you? How do I learn from you? It
Wow.
was a very life changing experience.
That's incredible. That's really incredible. So then you knew that you had PCOS. Were you upset about it? Did you feel, I mean, you were so young, so you probably didn't realize the impact it was going to have in your life. And now, fast forward, you're trying to have a family, you're trying to deal with symptoms. Did you have any idea really what that would mean for you?
I didn't, to be honest. I guess I didn't realize how serious it could be and how it would impact all facets of my life. Genetically, my family is very lean, so I didn't have that classic PCOS appearance. So I didn't suffer from that. Tell a teenager you're never going to get a period, they're really happy. So I was like, oh,
Yes.
wonderful. I won't get a period. That's
Hmm.
great. And then I didn't get the infertility part of it because she told me, like, you're going to pop a pill and you're going to get pregnant. And, that's all PCOS is. You're missing the ovulation. And so I guess I truly didn't grasp that understanding of how severe your PCOS can be and how it can vary from patient to patient, until I started trying, which almost did a disservice to myself because I was so reluctant to seek care and intervention because I blamed myself. I'm like, well, if that's how it's supposed to work, then why is it not working? Like, what am I doing
Hmm.
wrong? What am I missing? Let me try one more round. And don't advise that. Don't treat yourself, right? Doctors are the worst patients.
But as women, we know we blame ourselves for everything also, right? I mean, that is so tough. And I'm sure a lot of you out there feel the same way. We're always looking for an answer. And if there's something wrong, it must be our fault. And that's so difficult. And PCOS is one of those things that's so difficult to understand and to treat. And so I imagine, you learn this at such a young age, it's impossible to grasp the gravity of it.
Definitely. I started learning more and more about how it impacted me and why it was so different from me, I just started going through treatment, and I was just in residency. So to be honest, I didn't understand it thoroughly. And I actually had that is dismissed by doctors. I remember sitting in front of one fertility doctor and saying, well, of course it's not working. And it's because you're not PCOS. And it's like, you're too skinny. You're hypo. For audience, hypo is hypogonadotropic hypogonadism. And they look very similar to PCOS. They don't ovulate, so their numbers are really high, and they don't ovulate, so they don't have cycles. So they look very similar without the testosterone levels. And I was sitting there crying because now I'm like 2 years into my journey. Nothing's working. I'm switching doctors. And to be almost ridiculed, it was really hard. I remember crying and walking out of that conversation. And I was hormonal and I was upset. So I'm sure I overreacted. But it was really upsetting. I always tell
Yes.
people, every PCOS is so vague that no one looks the same with it.
So how did you get through that? How did you manage then to kind of recover from that and then get the information that you needed?
I switched doctors.
Mhm.
I'm a big advocate of making sure you're the right fit. It has to be the right doctor, the right patient. It was a learning experience because that's when I truly learned that, hey, I don't know enough to have a rebuttal. I'm just in residency, and fertility is such a niche and it's so detailed that I have to truly understand this in order to advocate for me and my body, and then eventually for my patients too.
Mhm.
Like, how do I educate me? So I always tell my patients, like, my job as a fertility doctor is to educate you and empower you so you can make well-informed decisions. Because unlike other medicine or other medical fields, fertility is not, this is the right answer, you have to do this. It's all probabilities, right? It's, if you do XYZ, the probability is this. If you do XYZ, the probability is this. It's one, the good thing is it's never a never. But two, it's also not, you have high blood pressure, you need this type of medication, I'll check you in 6 months. It's definitely not linear. So the best tool I utilize to kind of overcome that is to educate myself about my body, what I think may be causing it. And then I continue to advocate my patients to learn about their body and teach me about their body.
That's fascinating. So how did you know? I mean, here you were practicing already, right? When this happened, when you were trying to build your family. And here you are in the situation. It must have been so frustrating for you as a physician to not be able to just quickly fix the problem.
Yeah. It is definitely, especially if you're type A. I'm very type A and a control freak. So that was also a downside that it worsened the fertility roller coaster because every month I would do treatment, then I'd plan a birthday, then I'd plan a name, then I'd plan my next, and then it
Oh,
would come crashing down. Another takeaway that I always tell my patients, piecemeal it, because I think that caused a lot of burnout in my own journey. I had to take a lot of breaks because I felt like, even though it wasn't, mourning something that you never had, but you're pursuing that treatment with an intent of it working, and
yes,
you mourn that loss. It is a
yes,
loss when it doesn't work. And I don't think anyone ever tells you that. It's almost like same thing with my embryo transfers. When I would fail to implant, it was a loss. It was embryos that I worked really hard to make. So I always say, like, compartmentalize if you can. Of course, it's really hard to do, that one step at a time, to help, with the longevity of the treatment process.
yeah, yeah, because it is a marathon for a lot of people.
Yeah.
And so, as you were going through this, I'm sure it was enormously difficult, and you had to decide, well, I'm not this typical PCOS patient. My profile is a little bit different. I've got to figure out how to manage it myself. And so, how did you start to think about it? Were you thinking about it specifically medically? Were you thinking about lifestyle changes? What were you thinking about in terms of trying to deal with this issue?
Yeah. I started realizing that I had metabolic syndrome when I was being treated. I would have these early losses. I remember always getting these calls like, oh, you're pregnant, weight it's dropping, or maybe you're pregnant, maybe you're not pregnant. And then I was like, what is happening to my body? Like, what am I doing that may be potentiating it, worsening it, or causing it? And then I realized that, like my triglycerides are borderline high, my blood sugar is borderline high, and it's not high enough to someone to pinpoint and say, oh gosh, you're diabetic, or oh gosh, like, especially when I'm really lean.
Mhm.
So with my son, I remember I've never worked out in my life. I mean, now I work out all the time. I can't live a day without it. But
Mm.
during that time, I literally like finished college and went to med school, then got married and started residency. So that word didn't even exist in my vocabulary. But I'm like, maybe I should try this. Maybe I should try intermittent fasting. Maybe I should lower my carbs. And maybe there is some theory to this whole testosterone metabolic syndrome, decreasing the insulin spikes. And he actually, when I started doing that, I remember I did Zumba classes that whole month straight. And I don't know if it was coincidental, but that's that month I conceived. So
Wow.
yeah, he was my fresh transfer after multiple failed. So
Wow. That's amazing.
yeah.
Imagine your beautiful future. You're snuggling with your child. You feel so connected to them. Your friends and family are so happy, and you have everything that you've ever wanted. I want this for you too, but I want more than that. I want you to feel secure knowing that you've made the best decisions, not just short term, but long term for your future family. Wherever you are on your journey, whether you're choosing a donor, choosing a clinic, learning how to talk to your donor conceived child about their origins, all of these decisions will have wider implications for your future. And I want you to have the right resources so you can feel empowered and confident at this very important time in your life. That's why I'm so excited to introduce you to Building Your Family. It's the only expert-guided platform designed for parents and parents-to-be using reproductive medicine. We provide unique strategies that you won't find anywhere else to make your path to parenthood smoother and more informed. And that's why our approach is about offering practical and actionable steps that you can use right now. Whether you're just starting out or already deep into your process, Building Your Family is here to guide you with expert advice, specialized education, stress reduction strategies, and a community to support you every step of the way. We can't wait to see you inside. So after this experience, Dr. Jelani, I know that, it's so hard to not be able to control your experience. And it sounds like you were doing all the right things. And I'm sure now you see patients in the same boat, right? They're trying to do everything right and they feel very frustrated and upset. And it's kind of shocking for them. But for you, you learned when you were so young that something was coming, right? That there might be a potential issue. Do you feel like for some patients who find out later they're having difficulty getting pregnant, or maybe they've had a little facial hair, or maybe there's some other small signs that it's really difficult for them because nobody's ever told them what's wrong?
I think it's always hard, and I think we're always looking for answers. I think I had the advantage of knowing that I would need intervention sooner, but I don't know if I truly utilized that because,
Hmm.
denial is, of course, the first thing. So I'm like,
Hmm.
oh, she said that, but maybe I won't. And maybe I'll get lucky trying this. So I think it's just human nature
Yes.
to, even if you're, it's infertility, or knowing that you have infertility is almost being robbed of something so innate to you that you growing up think, like, I want 3 kids, I'm going to have them like this, I'm going to space them out, right?
Hmm.
I feel like everyone when they're younger dreams and thinks about
Yes.
that.
I certainly did.
Right?
Yes.
Same.
Yes.
I feel like when you're diagnosed with infertility, whether you find out sooner or later, it almost feels like that was robbed from you. So I think that loss and that part are always there, whether or
Hmm.
not it's more devastating. I don't know. I mean, I could tell you I had my first after 5 years of doing all this treatment,
Wow.
and then spontaneously conceived my second one while breastfeeding, after being told I need donor eggs or I need a surrogate. And then I never got pregnant again until I did 7 more rounds with my daughter, who I never thought I would have. So, and I'm so lucky that I have her, but I still feel like, well, if maybe I tried the fourth time, it would be easier, right? Like that.
Yeah, absolutely. Because there's no way to know. There's no, as you said, there's no magic formula. You just take this one thing and you have that result. It's so frustrating. to not be able to have control over that.
Yeah.
So difficult. You mentioned lifestyle. How much do you think lifestyle has to do with PCOS and its symptoms? But also, I guess, on a larger scale, if we're thinking about kind of regulating our insulin or doing anything that's maybe potentially good for our health, are those things also helpful in just trying to conceive, do you think, in general?
I 100% think so. I was actually just talking to one of my old partners, and I was telling them there's this entire demographic that I feel like we're missing, right? Usually, as fertility doctors, we see them after they've exhausted, like they've tried on their own. Then they usually
Hmm.
go to their OB. Sometimes the OB intervenes, and then they come to us. So, the type of patient that's sitting in front of us, it's not like I'm starting to try, help me. It's Jesus, I spent 2 years, 3 years, 5 years, 10 years, and it hasn't worked. And I'm here as a last resort. If you truly listen to your body, right, infertility is premature ovarian aging. That for some reason your ovaries aging faster than the rest of your body, and it's causing these eggs to not be of good quality. Whether there's too many like PCOS and they're bad quality, whether it's endometriosis and they're bad quality, but it's something, there's like a root cause causing them not to match your chronological age. So if in general we lived like Mediterranean lifestyle, which is less processed food, more fruits, more vegetables, more omega 3s, right? That's the only proven diet that's optimal for fertility. That's a diet that's lower on the glycemic index, that doesn't worsen your PCOS. If we followed the moderate to mild workouts that is recommended from like cardiologists and metabolic health, that's also what's good for fertility. That's also what's good for patients with PCOS. So I think the more you take care of you and eliminate this toxin exposure and live an overall healthy life, we would do better. But we all live a very fast paced life and our sleep's all over. And I know I grab fast food way more than I would like to admit. It's hard to do for sure.
It's hard, but I think you're a beautiful example of what can happen because I know you've talked in other circles on social media and in other podcasts about your work life too. And I know that you are one of the biggest producers at KindBody. You kind of hit the record with the most retrievals, and you've got so many things going on in your life, and you have 3 children. And so it's really remarkable because I know one of the symptoms people have in PCOS is feeling tired and draggy and not feeling like they have enough energy. So, how do you keep your energy going?
Passion. I
Hmm.
love what I do. And truly, the only reason I'm able to grow my practice like that and do what I do is because it's a passion project. I love helping people. And I feel like if you educate patients, then you give them the autonomy to make the right decision, right? I remember one of the biggest burnouts was, I will never forget this day because I was so frustrated. I was getting treatment in Michigan. It's not a mandated state, so I had zero coverage. We're both a really young doctor. He's a really young lawyer. We're literally piecing our dollars together to start treatment. And I had a failed cycle. And I remember saying, I know it didn't work because I had my blood drawn at my lab and it's negative and I'm bleeding. Can I come in for my next cycle? Like I have my stuff ready. And they said, no, 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 no. The doctor needs to make sure it's truly negative. We need to document it. So I said, well, I'll send you my stuff. And they're like, no, we need you to come in. So I remember going in, paying a hefty cost, and then I called back and I'm like, okay, I went in. Can you guys give me next steps? And then they were like, no, 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 no. Now you need to come in for baselines. And I was like, I just came for laps. They're like, well, this is our rule. We have to come in. So I suck it up and I'm like, okay, fine. I get it. I'm going to go back in for next baselines. Then I went in back again and I'm like, okay, now can I get next steps? And like, no, 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 you have to meet with a doctor. I'm like, why is this?
What's going on?
Yeah. I'm like, why is this so difficult? And I get it, right? Everyone's busy. And I, as a doctor, can attest that my nurses work super hard and they're busy. But there's no reason that I should miss out on a cycle, which for me seems like a lifetime. Remember, I wanted my baby yesterday,
Yes.
because no one's available to just meet with me. So, what I truly do for my patient care is I really try to educate them that, like, every time I meet, I'm like, this is plan A, and if plan A doesn't work, this is plan B, and if plan B doesn't work, this is plan C, and these are the intervals we're going to meet. Let me help you carry you through this journey, but we're partners in this. So let me educate you so you can make a decision with me and understand why I'm recommending what I'm recommending. So I would like to say my patients are really well educated, so my dropout rate isn't as high, but it really stems from having gone to every clinic, probably in another state,
Mhm.
because I was frustrated. I was frustrated with the system. I was frustrated with the process, and no fault to any doctor or nurse. Like, I don't, it's not their fault. It's just the system.
And so you just dedicated yourself to making the process for your patients different.
Yeah.
That's wonderful. So while we're on that idea, for everybody out there, could you tell us a little bit about, from your perspective, when somebody comes to you and says, I can't get pregnant, I don't know what's going on, and you might have some signs of PCOS. What are you looking for? What are you telling them?
People always Google, and I know I did. You won't believe it. I remember literally, this is my cousin. He was in med school, and he was like, let me help you. And I was going through this. He goes, oh, you don't look like PCOS. He goes, you don't have chin hair, do you? And I was like, no. And I'm like, I'm Indian. I have hair everywhere. One, but I, for as far as PCOS goes, I think one of the most common misconceptions is you have to be obese, you have to have this excessive hair, you have to be balding, and no periods. But there's variants of PCOS, and PCOS is you rule out everything else and then you rule in PCOS. There's not one blood test that looks for PCOS. There's not one ultrasound that says, oh, you have PCOS. It's a conglomerate of various symptoms that fail to meet other common diagnoses that mimic it, like congenital adrenal hyperplasia, like hypopituitary hypogonadism, where people don't get cycles. Or actually, I've had so many patients, my poor patients, who come in and who are a little bit heavier and don't have periods, and like, oh, I'm PCOS. My doctor diagnosed me, and in reality, they're in menopause. And just because
Wow.
they looked in menopause, you also have high testosterone, so you get this random chin hair, and they're not getting cycles, and they're like, oh, you're obese, you must be PCOS. So I always tell my patients, like, be careful, because PCOS is, one, really common. It's probably one of the most common things we see. But two, there's not one test for it, and there's not one phenotype, like a physical appearance for it. You want to rule out everything else before you get that sticker.
And so then what do people do then? So they come to you and they say, here are my symptoms. And then how do you then, once you decide, okay, well, this must be it, how do you proceed then?
So once you're diagnosed with PCOS, granted your fallopian tubes are open and your sperm, if you're trying to get pregnant, is fine, we typically start with what's called ovulation induction. Ovulation induction is when we give you a fertility pill to help you ovulate and release the egg, and then we time the intercourse or time the insemination with your ovulation, and then hopefully you're pregnant. And I dropped out a lot after this because I was like, oh my God, I'm intervening. I'm doing so much. I see the egg and it doesn't work. And I always tell my patients, remember, the chance of this working, the chance of conception is at best, if you're in your late 20s, early 30s, 20% per cycle per month, because there's so much to this. The sperm has to go to the egg, it has to penetrate it, has to fertilize, it has to become an embryo, and then come down to implant. So typically, after you try this for 3 to 4 times and it hasn't worked, then the next step is IVF, because with PCOS, you could have poor egg quality, you could have poor fertilization, you could have so much. So usually, if you're not successful with this, the next step is IVF, independent of what your root cause is.
And while they're doing this, they're probably also making lifestyle changes, right? And doing all the things you mentioned, changing their diet, exercising more. What about other things that they can do? Are there things like dealing with toxins or taking supplements or anything else that people should be doing?
Yes. I always tell my patients CoQ10 is probably the most studied for both egg and sperm quality. Inositol is also really well studied for patients with PCOS to help with the insulin resistance and the testosterone component. I cut back on my carbs. You don't want to spike, you want foods lower on the glycemic index. For me, it was just easier to cut back instead of studying the type of carbs I had. Keeping a food diary really helps. It helps you actually stay accountable. Once again, independent of what your underlying cause of infertility is. And then my patients with PCOS, even, I was guilty of this. I was like, I don't need to work out, I'm fine. But it's not necessarily for your physical health, but more so for overall health. And then make sustainable changes. I would say that would be my biggest takeaway, because I would make these extreme short-term changes. Like, I'm not going to dye my hair. I'm not going to wear makeup. I'm
Mm,
not doing nail polish. And then it wouldn't work. And then I'd get so upset because I, changed
gave
who
up
I
everything.
am. Yeah, I gave up everything and it's still not working. So my biggest advice would be make changes for overall good and that are sustainable, that you can maintain, that are not just tied to fertility. Like, now I've continued to do so because for PCOS goes beyond fertility. It carries out to heart disease, it carries out to uterine cancer, it carries out to so much more than
Mm,
just building your family.
wow. So these lifestyle changes are really important.
Yeah.
And as you said, they're very hard to do for a lot of people. And it's difficult to say, okay, we're going to do X, Y, and Z, and then all of a sudden you don't see a quick result for it. But if you stay in the game, chances are you'll be able to get pregnant for most people, right?
Yeah. Yeah.
That's great. That's great. And so, what do you recommend that people do? Let's say they meet with their doctor and their doctor is dismissive, because I know a lot of people are talking about that. They're saying, just like in your example, people say, oh, don't worry about it, you'll get pregnant. And they're not really identifying the PCOS.
I think if that happens, that's, immediately that's not the right fit for you, right? I've learned very quickly that if you have to fight to voice your opinion and be who you are, and the doctor's not listening, then that's not the right relationship for you. And that's not where you want to pursue treatment. So you want somebody who's willing and open to listen to you. You've lived in your body longer than anyone has, and you know it best.
So, Dr. Jelani, this information is so helpful, and I really appreciate your story and how much you've shared with regard to feelings of loss and disappointment and hurt, because it's so important that patients really understand that this is a long journey and a tough one. And certainly with PCOS, as you mentioned, it takes so long to get a diagnosis and then it stays with you forever. And so, what do you also recommend that patients do in terms of sharing that information with their family or friends? Because I suspect you had to explain this to your husband and to your friends, and then you had to, decide, how am I going to deal with all of the symptoms?
Do it when you're ready. To be very honest, when I was first diagnosed with PCOS, I come from a very conservative Indian family where you don't really talk about reproductive health and fertility and puberty and any medical conditions, in fact. So it was something that was diagnosed and then never spoken about again until it'd be time for my annual and I'd go see my doctor, and then she would treat me, and then once again over and over. So it was kind of ingrained in me to not talk about your reproductive organs or fertility or your period. And so my first journey was really hush hush. I didn't talk about it. I didn't talk about infertility. I didn't talk about needing help. I didn't talk about seeking care. I didn't speak about loss, which people don't realize it makes your postpartum really hard. And patients with PCOS that are at higher risk of depression and anxiety because of so many variables like that, right? They not only have body dysmorphia because of the weight gain and the hair growth and the hair loss, but they also have cyclical changes and all sorts of things that go with it. So my postpartum recovery journey was really hard with my son. So I made it when I moved over back to Chicago and social media started becoming a thing. I almost decided that it's a mission that I'm going to try to fill a gap that I felt was really missing. Like, I remember that was the first time I think there's a YouTuber that was going through IVF in 2016. She started posting about it. And then I moved back where my family and friends are. I grew up in Chicago. So people started asking me about what I do and trying to learn about it. And I remember I had a very young Indian couple who the wife was so scared that the in laws were going to make the husband leave her because she was infertile.
Oh my
And
God.
yeah. And she said, I hide my medications in a tree. And I was like, what do you mean you hide your medications in a tree? She goes, yeah, my in-laws live with me and I have to hide them in a tree because it's cold outside. So I go outside at night and do them. And it, to me, I was like, oh my God, my silence is perpetuating this stigma, because if I'm not sharing my journey and if I'm not sharing that it's way more common than we think it is, I'm allowing people to think and feel like there's something wrong with them and it's unique to them. And I don't want to be a part of the problem.
That's incredible. And certainly as a fertility doctor, people probably would take one look at you and say, wow, she's this great fertility doctor and she's got this beautiful family and your pictures on social media are so wonderful. And so I think it's even more important because people can see that there is something behind these beautiful pictures, that it wasn't so easy to get there for you. And you have had to deal with all of these struggles. So I really appreciate you sharing about it.
Thank you. Thank you.
Oh, you're welcome. And, I wanted to ask you one other question. You mentioned that you were part of research regarding ovarian sufficiency and what the impact of chemicals and environmental toxins were. Could you share a little bit about that with us? Because I know it's not specifically related to PCOS, but it's certainly in the news.
Yeah, 100%. And it kind of ties not so my I was trying to figure out the why. Like, why were my eggs so bad that, does PCOS really cause them to be so bad? And then I realized it's systemic inflammation. And believe it or not, that systemic inflammation and how it impacts egg quality is very similar to how environmental toxins impact your reproductive health. So what they basically do, both of them, is accelerate ovarian aging. So even though your chronological age, the age you are by number, is younger, like as in my 20s, my eggs were acting much older. And that's what the eggs, when exposed to these toxins, start acting like. So I was actually a Warher Scholar at a K-12, and my thesis and all my research for my MD PhD was on oxidative stress and ovarian aging. So how exposure to all these microplastics and EPO and can accelerate function of your ovary, like decrease function. So your chromosomes are abnormal, your fertilization rates are lower, you have a higher chance of infertility and miscarriage. And just
Wow.
because it's this constant micro exposure that causes this cumulative effect.
And I'm hearing that this is pervasive, right, in your body, that it can get into your brain, it can get
Yeah.
into your lungs, it can get everywhere, right? So,
Yeah.
yeah. So, all of you out there, take heed. Do not put anything plastic in the microwave. Don't drink plastic from plastic bottles. Do what you can, right, to
Yeah.
take care of yourself.
For sure. Small changes go a long way.
Yes, yes. Well, thank you so much for all this fantastic information and again for sharing your story. Dr. Jelani, do you feel like there's anything that we're missing as we're talking about this? Anything else that patients really need to know?
Give yourself grace and educate yourself and ask questions. Don't be shy. I know I was shy and I would be worried that, my God, I shouldn't be asking that. And I should either know it or I'm going to be embarrassed that I'm asking it. So don't, and I'm a doctor. So I always tell my patients, like, if I, as a doctor, can ask what size needle to use, like, please ask away. There's no silly question.
That's so lovely. That's so lovely. Well, thank you for that. Thank you for your warmth and your kindness and everything that you share on social media and with the world. We really appreciate it.
Of course.
And where can people reach you, Dr. Jelani?
You can find me on my social. I'm always active. It's my first name, last name, and MD. If you want to email me directly, it's roohi.jelani@kindbody.com. And I'm always by my phone. So usually on my socials is where you'll find me.
Great. That's great. So I hope all of you reach out to Dr. Jelani. As you can see, she's a wealth of information and a lovely person and very approachable. So please ask the questions that you need to ask so that you can advocate for yourself. It is so important. And thank you for coming. We really appreciate your time. Please, before you stop, press subscribe because that's how we keep going. And I look forward to seeing you next week. Thank you for joining me today. I hope this was helpful to you. And if you'd like more personalized support, more information, and more education, you can find it in the show notes under the Building Your Family community. We'd love to see you inside. And if you were interested in today's topic, you will really like this video.